welcome to you as well. We will now begin a round of 5-minute questions of our witnesses, and I ask my colleagues to please keep track of the clock and stay within your 5 minutes. Dr. Volkoff, I wanted to start with you. As I mentioned in my opening remarks, across the country, overdose deaths continue to rise dramatically. Last year, they spiked in my home state of Washington by 30%, and much like the rest of the country, were really driven by fentanyl. This is really a national crisis, so we've got to be using every tool that we have to support our communities, including fentanyl strips, which Secretary Becerra mentioned at his hearing here a few weeks ago. The research I've seen indicates that those strips, which are used to detect fentanyl in drugs, are an effective overdose prevention tool, but they require several steps to use them, including chipping off some of the pill to be able to test it. Can you tell us what the research shows about the effectiveness of those test strips, and really, are they easy to use? Can you talk a little bit about that?
Yeah, thanks very much for that question. And indeed, the fentanyl test strips have been tested for sensitivity and specificity. And the data shows actually high sensitivity, and there are only a few fentanyl analogs that are not detected. Having said that, the fentanyl test strips were developed for testing drug use in urines of patients that are being monitored. And so now this is a new application, and as a result of that, there can be problems on how it's implemented. Overall, patients that have used the fentanyl test strips report positive outcomes, and actually in terms of identifying drugs that may put them at higher risk. The research is now ongoing to try to determine what are the optimal guidelines on how to use them, number one. But number two, if the results are positive, what is it that the individual should do in case that they still want to consume them? As you know, there are still multiple problems in terms of making these fentanyl tests available throughout the United States, and there is interest on actually determining and getting approval for some of these tests by the Food and Drug Administration so they can be utilized in healthcare settings, which is not possible at this moment.
Well, are there other overdose prevention strategies that you and HHS hope to roll out in the coming months? Talk to me a little bit about what we're doing in terms of prevention.
Prevention strategies that have been shown to be widely effective is perhaps one of the most important ones is widespread distribution of naloxone. And that becomes actually in some instances a challenge if the naloxone is not available for those that use them. Another harm reduction practice that has generated a lot of attention is the extent to which, because the drug supplies is so extremely dangerous these days, in which safe injection sites could be valuable for patients that otherwise may be at very high risk of overdosing. And while the data is still preliminary in the United States, in other countries, they have shown that in certain settings, they can be quite effective. So there is interest on evaluating them. There's also interest in the community to test other products that may serve as harm reduction. For example, the use of kratom, which is sold as tea, and that contains a drug molecule that has effects that are similar to those of buprenorphine, but could be utilized also for decreasing withdrawal depression. So these are more novel, and we don't have sufficient data, but those are things that are being discussed.
Okay, thank you. Dr. Hodes, it is said that science is a marathon, not a sprint. However, Congress has really approached investing in research to treat and cure Alzheimer's disease and related dementias with really a sense of urgency. We have poured resources into this research, $17 billion since 2015, to really supercharge the discovery process with the goal of finding a treatment or cure by 2025. And I'm concerned that NIH isn't positioned to meet that deadline. Given the sheer scale of federal investment, what is NIH doing to deliver meaningful and measurable outcomes that assess its progress towards finding effective treatments?
Thank you for that critical question. And let me answer it very briefly in terms of process, and then with some examples of meaningful accomplishments during this time. As you know, we've counted on critical input from the national and global research communities, advocates, et cetera, with our annual summits, all of which feed into a careful identification of milestones, that is, the goals and targets which are necessary to meet our most important needs. I want to take a moment just to thank the staff of this committee for the interactions we've had over the past year to help us focusing these milestones into meaningful, quantifiable outcomes and making them transparent and available. To touch on just some of the examples of important advances, I would point starting with our clinical trials. So, for example, in pharmacologic trials, there are currently 8 studies targeting amyloid or not, which are phase 3 in their latest stages, capable of identifying definitive positive outcomes, meaningful outcomes clinically, which are due over the next years to reveal their answers. There are some 62 early phase clinical trials at a variety of targets, 3/4 of them not amyloid. These are the results of basic science, which has found more and more potential targets. So the clinical trials or investment in them critically important. You alluded as well to the burden on families and those living with dementia. That's also an area of clinical research, clinical trials. We now are funding a large number of trials studying interventions for care and care providing, which will be producing their results. The National Academies identified 2 of those generated with NIH funds that are ready for dissemination, being disseminated with further evidence. Happy to elaborate as time allows, but these are some of the examples that of accomplishments and of our important process to continue being accountable to ourselves, to you, and to the public for making the best use of these very critical funds to accomplish the highest of priorities.
Well, thank you. And I think transparency is really important. This deadline's right around the corner, and we've put out a lot of money for this, and we need to know as a Congress how those investments are going. So look forward to working with you. And Senator Blunt, look forward to working with you on that as well.
So thank you,